So what do we use clearance for? It determines half-life, determines the overall exposure of the drug, this thing called area under the curve, and determines the maintenance dose of the drug we need to give to maintain a particular plasma concentration. So the relationship between clearance and half-life is like this. So half-life is proportional to the volume distribution over clearance. So the larger the clearance, the more avidly the drug is taken up by an organ, then the shorter the half-life, and vice versa. When it comes to drug exposure, the area under the curve, which is the exposure to the drug, is determined by the dose that we give over the clearance. So if you give a set dose of, say, 10 milligrams or 1,000 milligrams, if the clearance value here is low, then it results the drug hanging around for a long time, and it results in quite a large area under the curve or a large exposure to the drug. And variable clearance between different individuals or in the same individual at different times then results in variable half-life and variable exposure to the drug. So this is what we want in terms of drug development. You want to be able to have something where a set dose results in fairly predictable half-life and fairly predictable exposure. This results in a standard dose administered with standard frequency, like once a day or every 12 hours. If the clearance is variable, then you have to give a different dose to achieve a particular exposure, as well as different frequency with chronic dosing. So this is not at all desirable when it comes to developing a drug. The relationship between clearance and the maintenance dose is like this. So the steady state concentration of the drug, and we'll talk about steady state in a different lecture on half-lives, is equal to the dosing rate over, once again, clearance. Now, to get really technical about this, the level of stuff in your body is equal to the rate of stuff going in over the rate of stuff going out. This kind of makes sense when you put it that way. And if you just swap these around with a bit of algebraic reformulation, you can see here that the dosing rate of the drug is the steady state concentration you want to achieve times by the clearance. So in the case of medications that we monitor for, such as digoxin or vancomycin or lithium or carbamazepine, if we know the concentration we're aiming for, and we have a rough idea of the clearance in that individual, then we can figure out the dosing rate without having to muck around with trial and error. So our clinical trial example here is of a drug that has different clearance values in different subjects. So here we have a fairly typical concentration time curve for different subjects, or what's called a spaghetti plot. So we have time here, and we have the concentration here, as you can see, in a logarithmic scale. And this is an intravenous infusion which is given over an hour, and you can see that the drug concentration rises nicely. And in fact, most subjects have a concentration which is roughly in the same sort of area. But then once the infusion stops, you can see there's this sort of considerable splaying between different concentrations in different subjects. So in some subjects, they have low clearance values, so the drug hangs around for longer, as in the case of this first subject, and so the concentration sort of goes out here. In other subjects, they have higher clearance values, and so the concentration falls more rapidly. And this is also important because it then impacts the overall exposure, or what we call the area under the curve, and that term comes from this. And if we were to then draw a curve of this area for this subject, we get this. So this represents the overall exposure that that subject has to this drug. If we were to compare that against this subject here in yellow, you can see that even though the peak concentration is the same, this subject here in yellow has quite a substantially larger overall exposure, or what we call area under curve. And that's because that subject has a different clearance value for this drug. So to summarize clearance, It determines how avidly the body gets rid of the drug. And the main organs for clearance are liver and kidney, although others can be involved as well. And for monoclonal antibodies, binding to the receptor and getting cleared is very important. In clinical trials, clearance helps determine the half-life of the drug, which is important when we're looking at when different things are occurring and whether they're related to the medication or not. The overall exposure at a particular dose. And it's desirable for clearance of a new drug to have low variability between individuals and at different times in the same individual, and to be independent of the concentration. So the clearance value then doesn't change whether you have a lot of the drug on board or very little of the drug on board. So as you're sitting there sipping your coffee, remember that clearance of caffeine is influenced by a large number of different factors, including sex, smoking, pregnancy, diet, medication, as well as different diseases. And the half-life varies between 1.5 to 9 hours between individuals. So in fact, it's the variation in clearance of caffeine that contributes a lot in terms of how people tolerate it, as well as the effect that they have as a result of drinking a cup of Java.